You mentioned voices, hearing voices. Do the voices change depending on whether you feel normal or whether you feel depressed or whether you feel manic?
Yeah, they do. I would hear sometimes, if I'm feeling manic, I might think that a certain girl likes me, and like I'll hear her voice saying, "Hey, you look good." Or I feel depressed, and I'll hear like, "You're nothing, hurt yourself."
One of the things that people see in schizoaffective disorder is that experiences like hallucinations may happen even if there isn't a manic episode or if you aren't depressed. Can you recall something like that happening in your life?
Well, for a while, I would hear voices. I would hear voices a lot when I wasn't on medication.
One of the key characteristics we look for in a diagnosis of schizoaffective disorder, and you asked about this, is whether he's had the experience of psychosis while in a normal mood state. And he answered you, and over the course of the interview, I came away with the impression that he's had psychosis during a period of normal mood, but it was hard. Marion, what do you, when you talk to patients, do you find this to be so?
Definitely, because he even described the idea of being irritable and angry most of the time, even now. So he really gave off this feeling that he deals with mood stuff a lot.
With depression, you have a lot of suicidal thoughts. At least I did. I was scared to be around razors and knives, afraid of what I might do to myself.
What does depression feel like for you?
Depression feels like being rained on. And the more you try to find somewhere to get out of the rain, the more rain pours on you, and you just become weighed down and more weighed down.
It's really hard to say a patient has had mood symptoms the majority of the time over the active phase or even during the residual phase. So
which would be the key point of calling the schizoaffective
exactly, and which has changed from substantial way back in the DSM-4. So there's a change, and it's hard in that little snapshot picture to take a look at that unless you have really good supportive collateral. Even then, it's hard to make that decision at that time. That's why the transition to outpatient with good follow-up, the outpatient psychiatrist then can follow and continue on to see if that's an accurate diagnosis or not.
I've been seeing a psychiatrist regularly, and I've been into a couple of outpatient partial hospitalization programs, and just trying to get some type of balance in my life.